and moisturizer. And doxycycline also works here as anti-inflammatory agent. That is important. Treatment of acne in pregnancy. Yeah, we just discussed last 3 slides. Important is you can use benzoyl peroxide and azelaic acid in pregnancy and not anything else. And sometimes oral antibiotics you use if you find it. Should oral isotretinoin be used 30 minutes after food? Well, it should be taken after food. That is important. And a new micronized formulation, you really don't need to be taken this thing. So again, it should be taken after food. Fatty food is better. Third stage acne management. Third stage is a moderate to severe acne. So here we need isotretinoin orally, and topical creams are important. Well, kindly elaborate treatment on hormonal acne. Where hormonal acne are different. Typically, we use anti-androgen activity like spironolactone. We do use oral contraceptives pill, which are ethinyl estradiol with progestin, which are specifically meant for PCOS. And a diane or a cyproterone acetate can also be used. So when to start OCP or spironolactone? So typically, if patient, you can try spironolactone, which is safe, 50 to 100 mg per day for 3 to 3 months. If patient has got really irregular cycles, OCPs come handy. 21 days. There are so many variety of preparations available with this combination like Yaz and Yasmin. Duration should be minimum 6 months to 1 year. You can't stop it suddenly. And important is obviously look for the parameters in the sense patient should get regular cycle. PCOD important is weight gain and acanthosis nigricans need to be monitored. So I think this is all we have got it for this thing, the question answer. Well, but I'm happy that you this because acne treatment is an art. With time, you will all come to know how to treat acne. Please stick to the guidelines, stick to the what is given in the books, because all other therapies like pills and lights are the add-on therapy, but the main therapy remains retinoids and BPO. I think that's all from the quiz questions. Over to you, Mariam.
So we are just waiting in case if there are any more questions for
you can ask, send questions if you want, because we have got some 3 to 5 minutes before we start the thing.
So a question from my side, doctor, would be like, do you see role of oral nutraceuticals in the acne treatment?
Yeah, there are many extracts like kiwi seed extracts and some of the herbs they have shown to have some efficacy. So typically those who don't want to take antibiotics, those who are wary of antibiotics, you can give this nutraceutical which has got some anti-inflammatory activity. Although the evidence is not great, none of the guidelines mention it to be at the line, but some patients do like to take it along with topical retinoids. You can give nutraceuticals because most of our patients if their food habits are not good, they eat junk food, they then don't get proper vitamins. So typically preparation should contain good amount of zinc and some B complex and some of the anti-inflammatory like alpha lipoic acid, antioxidant resveratrol.
चल बेंच क्या दिक्कत खा दो वो छोटा टोप पहन के चलूंगा मैं छोटा खुद मत पहन दो अच्छा
बदतमीज मत कर. All this have a role as a accompanying therapy. So add-on therapy nutraceuticals can be used. Thank you.
I think there are, Doctor, there are 3 more questions which have come up in the chat box.
Yes. So we have got 3 more. We have got still time. So always happy to answer these questions because acne has been our bread and butter right from beginning. Our 20% of patients are with acne. And when you treat one acne patient good, you will get 5 patients from that same person will get 5 of his colleagues to you. So I often say you treat one acne and you get 5 acne patients.
Yes, sir. So there are some questions, if you could see them.
I have to refresh.
Yeah. Do you want me to read out the question to you?
Yeah, I got it. I have it now. Yeah.
So does isotretinoin from
does isotretinoin causes water retention also? Now, water retention is not a hallmark of isotretinoin. It doesn't cause this thing, water retention. Typically, many of the patients do have thyroid abnormalities or something else. So, but typically, water retention is not part of isotretinoin can cause. Does BPO promote pigmentation? Now, BPO actually is a bleaching agent. When you apply BPO on sleep, your whole bed, there could be bleaching of your hairs also. So, actually, BPO causes bleaching effect. That is important. But typically, what happens in acne patient when you use adapalene or BPO or tretinoin, there is actually little peeling of the skin. And when patient next day goes out in sunlight, he gets directly his raw skin get exposed and he gets pigmentation. So that's why there is often saying the people feel that when I start treatment I become dark. It is typically that you have to use a regular sunscreen because it can cause worsening. Management of childhood acne. Well, childhood acne we have not touched, but it is now we see more and more children from 10-year, 8-year onwards get acne. So treatment remains same. Typically, they need good lifestyle, benzyl peroxide and anti-dandruff shampoo should be begin with, and sometimes we also give adapalene gel also. So that is management of recurrent acne, which has been treated with full isotretinoin. So again, you can get a second attack of isotretinoin. So best way to use the same isotretinoin in same full dose again. If you give complete 150 mg dose, chances of getting is less. If you do use a lower dose, then the relapses are common. So when you use a lower dose at 10-20 mg, relapses are common. If you give 0.5 mg per kg, then the relapses are less common. Diet is important. Typically, those who are obese and those who have got junk food is important. Zinc deficiency, well, zinc has a supportive role and there are some preparations available in topical form which has got zinc and oral zinc. Topical steroid-induced acne, we are already seeing. So your maintenance topical cream for acne is adapalene gel. They can use safely daily night for 2 to 4 hours so that a new acne form will not come. So typically I tell them to use it regularly for next 3 to 6 months. Isotretinoin minimum age, typically we do see very young acne, sometimes 12 years and onward or 14 years onward we do give, but typically should be given in adults only. Well, isotretinoin, does it work in gram-negative follicularitis? Well, there you need to use a cephalexin or something else and not this thing. Kojic acid can be used for pigmentation. It's a weak agent compared to azelaic acid. Pigmentation is common with acne because of our brown skin. So typically most of the patients should use a sunscreen. And what I find is 2% hydroquinone, kojic acid, vitamin C creams formulations are good. So that you can use. Peels, well, peels should have an add-on therapy. You can use the peel, salicylic acid peel for the acne again, but same effect you can get with using adapalene and tretinoin creams. Oral corticosteroids in pregnancy, typically we don't use it unless pregnancy, severe inflammatory acne, sometimes short course is required. Isotretinoin tapering should be slow, not very fast. Typically 3 months you must give full dose and then try to reduce it. Nadifloxacin is available as a topical gel, but it is not routinely used. Routinely what we use is clindamycin with BPO combination. Fungal acne, again, if you see acne with on the back, you suspect, you can give itraconazole formulation 100 mg for 2 to 4 weeks to control that, plus a antifungal shampoo. And isotretinoin needs to be avoided in males who are planning to for child. Again, there is very low evidence that you need to stop. Somebody on acetylcholine, yes, it is not to be used, but isotretinoin can be used. Zinc has a role, so we have this thing. Well, I think I have used most of them. I think we have touched most of them. I think over to you, Mariam.
Yes, doctor. Thank you so much for your patient answering. I'll hand over to my colleague, Mr. Rohit, to do the vote of thanks. Rohit, to you.
Good evening, doctor. And good evening, all the delegates who are present on the view link. I'm Rohit Gautam as DGM Marketing with the Regalis team. Sir, I would sincerely like to thank you for making this webinar a very successful one with good number of registrations. And the best part is the queries that have come up, you have been able to answer most of the queries in a very crisp way. And I hope all the delegates would be more than delighted and they would be happy the way the queries have been addressed. And this webinar wouldn't have been possible except under your guidance. And we sincerely thank you once again for this wonderful session that you have taken, sir. And as we know, this webinar was to be accommodated along with a webby quiz that again covers the questions from acne and related topics. So I would now hand over the session to Miss Marian, where she will be taking through these steps that every delegate and the viewers who are present in the viewers link need to follow before the quiz starts. So it's a very short PPT that she will be sharing. I would request everybody to please view it very carefully, and after that the quiz session will immediately start. So without wasting much time, I would hand over the session to Ms. Marian, and thank you once again from the bottom of heart, Dr. Kiran sir, for this wonderful session. Over to you, Ms. Marian. And the delegates, over to you for a good, attentive and a very important webby quiz that is going to start in another 1 or 2 minutes. Over to you, Ms. Marian.
Thank you. So I'm sure you all are excited about this webby quiz. So I'll just quickly take through, as Rohit had said, with the presentation. So as you can see on the screen, that once we go live